Welcome to the Ministry of Health review on infection prevention and control and hand hygiene. This is part 2 of a 4-part series entitled Infection Prevention and Control in Healthcare Settings. The goal of this training is to ensure safety and prevent and control infection in the healthcare environment. Today, we will focus on the number 1 infection prevention technique, which is hand hygiene. At the end of this presentation, you should be able to demonstrate knowledge of the procedures of hand hygiene, perform hand hygiene. Remember that reducing healthcare-associated infections requires that healthcare workers ensure that hand hygiene becomes a routine component of patient care. Hand hygiene. Why is hand hygiene important? Healthcare-associated infections are one of the major challenges of modern medicine. Research shows that hand hygiene reduces the transmission of pathogens to patients and the spread of antimicrobial resistance. In spite of this, the adherence to healthcare workers to hand hygiene has remained low. Hands are the main pathways of disease transmission during healthcare. Hand hygiene is the key measure to prevent the transmission of pathogens and prevent healthcare-associated infections. Before we look at how to perform hand hygiene, first examine the diagram on this slide. This diagram shows that the parts of the hands that are missed when healthcare workers perform hand hygiene incorrectly. From the diagram, the fingertips and the thumbs are the most frequently missed parts of the hand during hand hygiene. These are the parts of the hands that are in the most frequent contact with patients. Studies have shown that the hands are often not clean, even after people feel as though they have washed them properly. This image, taken from the New England Journal of Medicine, exemplifies the importance of hand hygiene in caring for patients, including those who are unknowingly carrying antibiotic-resistant pathogens. The petri dish on the left shows the colonies of the superbug methicillin-resistant Staphylococcus aureus, MRSA, that grew after a healthcare worker's hand was imprinted on growth medium. The healthcare worker had examined the abdomen of a patient who had not been known to have been colonized by MRSA. The petri dish on the right shows that no bacteria grew after the worker performed hand hygiene using an alcohol-based hand rub. This image visually illustrates the potential implications for further infection if a healthcare worker is negligent in hand hygiene. When to perform hand hygiene? The My 5 Moments for Hand Hygiene approach from the World Health Organization defines the key moments when healthcare workers should perform hand hygiene. This evidence-based approach recommends healthcare workers to clean their hands before touching a patient, before clean or aseptic procedures, after body fluid exposure or risk, after touching a patient, and after touching a patient's surroundings. Remember that some pathogens can survive for days on patient care equipment and environmental surfaces. Surfaces in the patient care environment are often contaminated with bacteria. Even if you do not touch the patient and only touch patient care equipment or environmental surfaces, perform hand hygiene after you leave a patient's room. A key element in improving hand hygiene is the use of an alcohol-based hand rub as a replacement for washing with soap and water in the traditional healthcare settings. But when should alcohol-based hand rub not be used and instead you must wash with soap and water? Wash with soap and water when hands are visibly dirty or visibly soiled with blood or other body fluids. After using the restroom, when exposure to potential spore-forming pathogens, including Clostridium difficile, is suspected or confirmed, hand washing is needed. How to wash hands with soap and water? Wet hands with water. Apply enough soap to cover all hand surfaces. Rub hands together for at least 20 seconds, covering all surfaces and focusing on fingertips and fingernails. Rinse hands under warm, running water. Dry hands thoroughly with a disposable paper towel and use the towel to turn off the faucet. When to use alcohol-based hand rub? When hands are not visibly soiled, when exposure to spore-forming pathogens is not suspected or proven, using an alcohol-based hand rub is preferred for routine hand antisepsis. How to use alcohol-based hand rub? Apply product to the palm of one hand, one pump or pull of the product. Rub hands together, covering all surfaces, focusing on fingertips and fingernails. Rub until dry. Use of hand lotion. Hand lotions prevent skin dryness and irritation. Use only hospital-grade approved hand lotions. Other types of hand lotions may make hand hygiene less effective and also break down latex gloves. Fingernails. Always keep natural nail tips less than 1/4 inch in length. No artificial nails or nail extenders when having direct contact with high-risk patients, such as those in the accident and emergency, ICU, or operating theater. Remember, cleaning your hands can reduce the risk of healthcare-associated infection. Performing hand hygiene at the right time and in the right way may save lives. Your support and compliance with hand hygiene is essential. In just 15 seconds, you can help stop the spread of infection. Thank you for participating in this training on infection prevention and control and hand hygiene, part 2 of a 4-part series conducted by the Ministry of Health. Please review the other parts of the infection prevention and control series and contact us for further information.